This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Worcester. The House and Senate passed a temporary 2-week continuing resolution last week, extending the government funding deadline to December 21st. Legislators are trying to avoid a government shutdown right before Christmas, but President Trump has stated he is firm on securing funding for a border wall in any year-end deal and that he is willing to shut down the government over the matter. ACEP will continue to monitor and provide updates as the congressional negotiations continue. This week, Congress is expected to send the ACEP-supported sickle cell disease bill, or S-2465, to the President for his signature into law. This bipartisan legislation will help collect data on the prevalence and distribution of patients with sickle cell disease and other blood disorders. The law will also reauthorize demonstration programs to improve the prevention and treatment of sickle cell disease. On the regulatory front, ACEP has been busy weighing in on proposed regulations from the federal government that could impact emergency physicians. These include a Centers for Medicare and Medicaid Services, or CMS, proposed rule that aims to reduce regulatory burdens on providers. In our response, ACEP states that while we support the administration's overall goal to eliminate unnecessary documentation requirements, we want to make sure that any possible changes do not have any unintended consequences that could pose a detrimental impact on the patients we serve. This week, ACEP also responded to a concerning proposed rule from the Department of Homeland Security that could prevent lawful immigrants who use public benefits such as Medicaid, food stamps, housing benefits, or Medicare Part D low-income subsidies from being able to receive permanent residency status, otherwise known as a green card. In its letter, ACEP strongly opposes the government's proposal, noting that if finalized, the ripple effects of the policy could cause many to disenroll from these essential programs out of fear and confusion, thereby worsening health outcomes, driving up maternal and child health risks, and increasing the spread of untreated infectious diseases. ACEP also cited concern for patient data and security and noted that physicians may be put into difficult situations when deciding what data to include in electronic health records, which could conceivably be seized by immigration authorities as part of their investigations. To read ACEP's response, visit the link on your screen. Last week, the Trump administration released health sector reform recommendations, outlining policy areas they say inhibit choice and competition in healthcare. Their recommendations included in the report would require both state and federal action. Some of the major recommendations include that states and the federal government should relax scope of practice restrictions and allow any provider who can safely and effectively provide care to do so. The report advocates loosening network adequacy requirements in Medicare Advantage and Medicaid and calls for states to avoid stringent requirements for network adequacy. It also states that the federal government should prioritize price transparency and should make it easier for patients to pay for health care directly instead of always paying using health insurance. ACEP is monitoring the report and any next steps from the federal government. With 100 new House members and 10 new senators elected to the incoming 116th Congress, ACEP is looking to get a head start on connecting with as many as possible before or just after their January 3rd swearing in. We will be setting up local meetings between ACEP 911 network members and the new members of Congress to introduce them to emergency medicine and our role in the healthcare delivery system and to establish a local contact in the healthcare space. The meetings will most likely be scheduled for about 30 minutes, and the ACEP DC staff will provide tips for the hosting ACEP members as well as a fact sheet for the new member of Congress. If you live or work in a congressional district of a new member of Congress and are interested in hosting or participating in one of these meetings, please contact ACEP's Washington, D.C. office for more details. Also, to sign up for the ACEP 911 network, please visit the address on your screen. That's ACEP's Capital Minute for the second week of December 2018. We have a busy 2019 plan and we can't wait to get started. In the meantime, we wish you all a very happy holiday season. I'm Laura Worcester. I'll see you again in 2019.